So we're going to continue with our series. I like that series of fireside chat. I'm here once again with Gerardo, our dental hygienist, and our next topic is going to be diabetes. Do we need to be concerned? Does it affect dental health?
Absolutely.
Absolutely does. Absolutely does. There's a big interrelationship between diabetes and health of the periodontal tissues, the gum tissues, the supporting bone. And it's not unoften that we'll see a patient, we'll look at their gums, we'll look at our x-rays and we'll go, do you have diabetes?
Yes.
And a lot of patients don't realize that maybe they do have diabetes. And very often symptoms will present in the gums. And one of the things I noticed, and I'm sure you noticed too, Gerardo, is that it tends to be much more aggressive in a person with diabetes. Would you agree?
I totally agree.
Absolutely.
Both are inflammatory responses. I mean, in diabetic.
Yeah, you're exactly right, because diabetes is an inflammatory disease. Gum disease, periodontal gum disease, is inflammatory in nature. Like I've said before, we're a complex system, and everything is intertwined. So absolutely, you'll see changes in a person's health, and it's going to affect the way the gum tissue looks. So what are some of the things that we'll see in a person with diabetes?
Well, it's pretty common to patients with halitosis because they're producing more ketones, more acids than the normal person.
That's bad breath.
Bad breath, halitosis,
right?
Inflammation of the tissue.
And that'll present itself as bleeding gums.
Bleeding gums.
It can be a little, it can be a lot.
It can be mellow, it can be aggressive. Every patient is different, so we have to treat them. Not to know how to treat every patient. It's not like a rule, like we have to do the same for everything.
But in general, I would think that, I would like to say that probably in a person with diabetes, any type of gum problem tends to be more aggressive. Would you agree?
Yeah, the bone loss is more rapidly.
Yeah, you'll see
progress
bone loss.
more.
And that's interesting, the bone loss patterns that we often encounter in a person with diabetes is you'll look at the x-rays, and the x-rays you'll see bone loss and it looks pretty decent, but then you get to one tooth and then boom, you just lose all that bone around that one tooth. And when I see that pattern, the first thing that comes to mind is this person have diabetes? Gum disease can run rampant. And this is interesting. This was something we were discussing earlier today. I was saying El Paso, unfortunately,
#1
is #1, the capital of diabetes in this country. Right here in El Paso, Texas. Not really something I think we want to be proud of, but it's a reality. Diabetes affects quality of life. It affects your kidneys. It affects just so many different things that can affect your overall health. We see a lot of our patients that do what because of bad kidneys over time. It's they have to undergo dialysis.
Yes.
They undergo dialysis because the kidneys are failing. And probably the biggest reason for failing kidneys is
Uncontrolled diabetes.
Uncontrolled diabetes. And so you got to take that into consideration. So we've established the need to control gum issues in a person that has diabetes. So how do we do it? How do we do it? I think a lot of people will think it's one size fits all, but really it depends. It depends. So let's talk a little bit about our protocol on individuals with gum disease. I think one of the things that we're big on here is the diagnosis. What are the problems, and why, in your mind, why is diagnosis so important that you've seen here in the office?
Well, as you said, we take a lot of time, a lot of detail into a very comprehensive exam to get into the bottom line of the problems.
The root cause.
Yeah, not only for gum problems, also for whatever the patient needs.
Exactly.
But
exactly.
So that's the most important thing at the beginning of the treatment, to diagnose, to do a good diagnosis.
And understand.
And make the patient understand what's going on. Not just go straight to the treatment without them knowing what's going on, so they can help us too.
And you bring up a really important concept, is that the patient has got to understand. I think if a patient understands what diabetes is, they can become more proactive at controlling it. And one of the things that we encourage, and I hope it'll come up here above our fire, is
El Paso
Diabetes. I think El Paso Diabetes, a nonprofit organization here in El Paso, is a great resource for anyone that has diabetes, because they'll educate the patients will understand what diabetes is, and they can be just much more involved in treatment, because diabetes becomes complex. It isn't just about taking a little pill and saying, I'm good. It goes way beyond that.
Yeah, unfortunately, diabetes is not reversible. So, as you said, with that association, I've seen patients that we refer to, and they can manage
and they get really better.
They get better.
Absolutely.
You see them 4 months after, and everything.
They look good.
They look good.
They take it serious. So the question is, well, for the most part, diabetes is, there's no real cure per se for diabetes, but it's definitely manageable.
Yes.
And the same holds true with any kind of gum disease, especially if it's periodontal gum disease. There's no such thing as a cure, because a person loses bone, it doesn't come back, but it is absolutely controllable and manageable. So how long do you need to take care of your gums? For as long as you have teeth. Take care of them. Treatment is predictable. It is effective, and the biggest thing is it is absolutely necessary to overall health. So if you have diabetes, if you are even pre-diabetes, give us a call. We'll be happy to help you and help you establish
whatever the best for you.
Best treatment, best dental treatment for you. If you want more detail, if you want more information about what we can do,
whatever your question is, just give us a call.
We'd be happy to see you. And between all of us here in the office, and especially working with Gerardo, you're going to see a big difference.